Tonight is Dr. Sandy Nelson, an associate director within the Division of Infectious Diseases at Mass General Hospital. Love to see you, doctor.
Great, doctor. Thanks for your time. Great to see you. A lot of parents take this opportunity to travel somewhere with their children. With the Omicron variant still circulating, do you think the risk of infection is virtually the same no matter where you go?
I think that's a great question. Rates, fortunately, are going down really across the country. This has been true in all states. There are still some hotspots. We're seeing higher rates in parts of the Atlantic, or the southern states like Kentucky, Tennessee, West Virginia. Within New England, the rates are still a little bit higher in New Hampshire and Maine than they are in Massachusetts. But again, I think the risk depends not only on where you go, but what you do on vacation. And when we're on vacation, we sometimes tend to let down our guards, and that does increase the risk.
So as you know, there is no COVID vaccine available yet for kids under the age of 5. So in your opinion, are there any special precautions that those parents should take if they're staying, say, at a hotel or they're going out to eat in a restaurant?
There's not really a lot of added risk to the hotel room itself. Of course, indoor dining is a risk, and that's been a risk throughout the pandemic. I think that individuals can continue to make individualized decisions based upon their own individual risks and their tolerance for risk. I do think vacation is a great time to spend time outdoors, and this is particularly true with young children. But when that's not feasible, then the same recommendations that have been made earlier in the pandemic, including distance is feasible and mask use according to the ability of the child to wear a mask and their risks and the risks of the household members.
Dr. Nelson, let's get to some of our viewer questions. This one comes to us from Art, and Art asks, what qualifies someone to get a COVID pill?
Well, the first is that you have to have COVID. So you can't be prescribed a medication without a diagnosis. The oral medications are only available at this time for people who are outpatients, not for inpatients. And individuals need to be within 5 days of symptom onset. The final criteria is that they need to have at least one risk factor for progression to severe disease. So these in general are not being prescribed for people without underlying risk factors.
Got it.
Interesting. Hey, here's another one. This one is from Samantha. I just got my free COVID tests from the government. Do you know if they're more likely to give false positives or false negatives?
So this is a really great question, and unfortunately the answer is that it depends. So the false positive and false negative rates are not intrinsic properties of the test. They depend on the context in which the test is done. So if the test is taken at a time when there is very little circulating disease, then a positive test is more likely to be a false positive. And on the flip side, if the test is done when there is a very high rate of circulating disease, then a negative test is more likely to be a false negative. So it really depends on the context. And if there is an unexpected result, the test should be repeated or a PCR test should be done.
Okay.
Great answer, Dr. Nelson. Thank you very much. Thanks for your time. Great to see you.
Thank you, doctor.
Thank you.